Hey folks, George here. This time we're going to examine a few articles regarding the ethics and morality around healthcare. The first question we're going to examine is around the question about whether or not there's a right to healthcare. The first article by Norman Daniels, which supports a right to healthcare, is entitled, "Is There a Right to Healthcare? And if so, what does it encompass?" Norman Daniels wants us to remember the legal philosophy of legal positivism. Legal positivists say things like there are no such things as rights unless they are codified by law. Unless it's written down in the law book somewhere, it's not a right and nobody has any such right. It's also important to recognize that a right to health care is a positive right as opposed to a negative right. That means a right to health care imposes obligations on other people. If I have a right to health care, that means I make demands on other people to give me health care, right? That's what makes it a positive right, right? With that in mind, the question emerges, so who should pay for this positive right to the health care that I demand? Of course, this has historically been a difficult question to respond to. Why? Because historically speaking and philosophically speaking, the notion of positive rights are always difficult to justify. That is, the right, a positive right that I make upon other people. Let's contrast that with libertarian philosophers. For example, Robert Nozick. Robert Nozick will suggest that imposing such obligations upon others violates fundamental rights. That is, libertarian philosophers like Nozick suggest there are only negative rights. What does that mean? It means ultimately people who are denied charity have no right to it. Of course, libertarian philosophers like Robert Nozick only recognize negative rights. That is, my rights to be left alone by you. That is, I have the right that you do not hurt me, or you do not harm me, or you do not steal from me, or those sorts of things. That, of course, contrasts with positive rights when I say, I have a right to something you have. Norman Daniels reminds us that utilitarian philosophers can provide a justification for such positive rights. After all, curing diseases reduces suffering. Of course, this is controversial. What is, after all, the scope of these utilitarian entitlements? Some philosophers will say, wait a second, if you are completely blind, right, does that mean that that person, given this utilitarian logic, has a right to at least one of my eyes? Since if I give them one of my eyes, they will be better off. Yes, I will be worse off, but the benefit that they experience from gaining one of my eye, from taking one of my eyes, is so much more of a benefit than the disadvantage that I suffer from only losing one eye. After all, if I only lose one eye, I can still see, right? And that, of course, does make some people look askance at utilitarian philosophy because it seems to be too demanding. So demanding that blind people, therefore, have a right to at least one of my eyes. Is that accurate or not? Well, that's another question, right? Another problem with utilitarian thinking is, might it actually provide more net welfare, more net benefit to society if, instead of, let's say, healthcare or my eye, if instead we invested in other things? That's always a possibility, and you have to weigh all of those alternative investments. That, of course, is a key challenge of utilitarianism. Can we ever accurately calculate the cost-benefit analysis? But what about an argument from equal opportunity? Consider this equal opportunity perspective. That is, diseases and disability restrict opportunities. Thus, healthcare maximizes opportunities for all. One philosopher who advocates such capabilities perspective is Amartya Sen, who suggests that we are required to give healthcare when it would equalize opportunity and capabilities. However, income and education also affect opportunities and capabilities. Also, natural talents and skills. For example, I am short and weak. Does that mean that I should receive services to help me grow tall and strong so I can be a professional athlete? All that is to say that we must recognize that equality has to be balanced with other things such as liberty and efficiency. We have all sorts of other competing values in our society. It's typical to say that we should have equal opportunity if there has been some unfair social practice that has limited opportunity. So there is no unfair social practice that has made me weak and short. After all, I could go to the gym and start working out to become stronger and compete. And even if I want to play basketball, there was a professional basketball player who's actually shorter than I am. My favorite basketball player of all time, Muggsy Bogues, right? So clearly, there isn't a social aspect to the disadvantages that I'm experiencing regarding my opportunities to play professional basketball. However, preventable and curable diseases or disabilities do interfere with the pursuit of some reasonable life plan. However, natural distributions of inequality, like height and strength, is acceptable. In fact, it actually enhances society. Thus, Norman Daniel concludes that not providing health care is an injustice. So, a right to health care is part of a right to equal opportunity, and that is reasonable. However, it is imperfect. Even still, there are limits within our society, resources, technology, etc. Not all societies, after all, have advanced healthcare technology. So, any right to healthcare has to be coupled with the society's technological and resource availability. What does that entail? That where I live, in New York City, in the United States of America, there are such rights to healthcare because here in America, in New York City, there is adequate resources and technology to provide people like me healthcare. However, there are other places around the world that don't have these resources and this technology, right? Some of the poorer countries around the world. Thus, in those places, there is no such right to healthcare. Of course, can some people retort against that? Perhaps. Explore that idea just a little bit further to take it further, but this is as far as Norman Daniels wants to go right now. Of course, what does this entail then? That healthcare which promotes normal functioning and that healthcare which is effective, that's the kind of healthcare that we have a moral right to. So, for example, I don't like that I have such a big nose. So, I don't have a right to get a nose job because getting a nose job to shrink the size of my nose does not promote my normal functioning. That second caveat, though, a right to effective healthcare is a lot more complicated, right? What is effective healthcare? I think Daniel's main point right here is to merely suggest that nobody has a right to miracles. But let's talk about my nose job and other cosmetic surgery for a quick second, yes? Perhaps I do not have a right to cosmetic surgery because I already have normally functioning body parts. However, reconstructive surgery is probably more likely to fit into a right to healthcare, right? That is, if I were severely injured in some accident or some incident such that I am terribly disfigured, then there would more likely, maybe not absolutely, but more likely there would be a right to reconstructive surgery, but not cosmetic surgery. Of course, there are other complications around this. What about reproductive health care? That is controversial. Abortion, after all, is a very controversial issue. Abortion, after all, is neither therapeutic nor preventative of some disease. But isn't infertility a departure from normal functioning? So that seems to imply that perhaps something like in vitro fertilization is more likely to fit into that moral right to healthcare. The crux of all of these examples is this: not to give firm and hard answers. Yes, there's a right to this care, but not a right to that care. That's okay, that's not okay. That's not what Daniel's point is right here. Rather, his point is there are a lot of complicated specific issues, and it might be reasonable for different societies to judge differently on what fits into this moral right to healthcare such that it shall equalize opportunity for all. The real key point here is that in all of this, when disability or disease limits opportunity, there shall be a right to healthcare to treat that disability or disease. Of course, there's always going to be a complication about how to allocate resources, but nobody's negative rights are violated, according to Daniels, to take resources from some people and give them to other people in order to maximize or lift these people's opportunity back up to a normal and equal level. So let's examine some questions here or some problems. How equal should this right be? So the problem is this: might the existence of some private healthcare attract doctors away from government-funded healthcare to privately funded healthcare where they can make more money? Well, in principle, Daniel says this doesn't need to be a problem, but it might have to be addressed. Another problem with private healthcare, let's say, especially if private healthcare is alongside public government-funded healthcare, is, does allowing private healthcare actually create greater inequality? Daniel's response to this is that as long as it doesn't undermine the basic coverage that people get, then certain inequalities are not objectionable. So those are some of the ideas to help Norman Daniels conclude that we do in fact have some right to healthcare in light of our value of equal opportunity. See you next time. Bye-bye.